Good morning, everybody. Bon matin à tout le monde. Nous allons commencer la conférence de presse.
We will now start today's press conference. Minister Leblanc. Thank you very much, Corinne.
Today, I am joined by my colleague, Anita Anand, the Minister of Procurement, and by Dr. Tam and Dr. New in Ottawa. I want to start today by thanking Canadians who are following their local health rules. Please continue to look out for your family, your neighbors, and your community by staying home when you can, by wearing a mask, and by always following the social distancing rules. Our government remains committed to supporting Canadians during the pandemic, and our Team Canada approach is focused always on the health and the safety of Canadians. Depuis le début de la pandémie,
Since the beginning of the pandemic, our priority has been the health and safety of Canadians. This is why our government has decided that the COVID-19 vaccine will be free for all those who wish to be vaccinated.
we announced the new vaccine distribution tracker, which is available online on Health Canada's website. Through this tool, Canadians will be able to follow our collective progress in the distribution of vaccines across Canada. And to speak more about vaccine distribution, I'd like to now invite my colleague, Anita Anand, to say a few words, followed by Dr. Tam and Dr. New in Ottawa. Anita?
Before I start, I would like to again thank all of our frontline workers who are facing extremely challenging conditions created by the current surge in COVID-19 infections. We know that following public health guidance is key to stemming the infection rate, and combined with the rollout of safe and effective vaccines, we will see our way through to the other side of this pandemic. Le Canada a agi rapidement.
Canada acted quickly in order to have one of the most substantial and diversified vaccine portfolios in the world. We reached agreements with vaccine manufacturers once we saw that they were producing promising vaccines. Thanks to our strategy, last month we had deliveries of approved vaccines, Moderna and Pfizer-BioNTech.
Guaranteed minimum of 20 million doses with options to purchase more. As the Prime Minister announced, we have increased our order with Pfizer to add 20 million more doses for a total of 40 million doses to be delivered this year. Canada is well on track to meet our goal of ensuring that we have enough vaccines that every eligible person who wishes to be will be vaccinated by the end of September. We are focused on delivery, working every single day to get these vaccines into Canada as early as possible, as we did last month. For example, as our negotiations with Pfizer led to the advancement of additional deliveries prior to the holidays, we have now confirmed an additional 2 million Pfizer doses will be delivered in Q2. These doses were originally scheduled to arrive in the third quarter of this year. They will now be delivered in the second quarter. This is the work of my department and me every single day, that is to accelerate deliveries of regularity. However, we should not forget about the extraordinary environment in which we are operating. Vaccine manufacturing is already highly complex, and when we factor in unprecedented global demand and complex supply chains, we should not be surprised that the ground is sometimes shifting. I want to be very clear on this point. I have not and will not provide concrete facts so that all involved can plan accordingly with as much certainty and confidence as can be provided in the current environment. Once we enter the second and third quarters, Canadians will see a dramatic acceleration in the pace of scheduled vaccine deliveries. This is the largest mass vaccination campaign in our great country's history, and every level of government, every department is doing its part. Public Services and Procurement Canada will ensure that we remain on track to meet our September goal with the delivery of a steady supply of vaccines. Et notre gouvernement continuera.
Our government will continue to try to fast-track delivery of vaccine doses. That way, we will be able to vaccinate Canadians as quickly as possible.
Canada effort. Together, we will see ourselves through to the other side of this pandemic. Merci beaucoup, Megwetch. Thank you so much.
Dr. Tam?
Good afternoon and bonjour à toutes et à tous. There have been over 668,000 cases of COVID-19 in Canada, including 17,086 deaths and over 82,500 active cases across the country. Nationally, the average case count is now over 8,100 new cases reported daily over the past week, with still increasing number of people experiencing severe illness. There are an average of over 4,500 individuals with COVID-19 being treated in Canadian hospitals, almost 850 of whom are in critical care, and 145 deaths are being reported each day. It has been a year and a day since scientists first published the genome of the SARS-CoV-2 virus that causes COVID-19. We've made substantial progress since that time with better diagnostics, treatments, and a greater understanding of COVID-19 spread and effective prevention measures, safe and effective vaccines against COVID-19. All around us, we can hear people saying, the light is at the end of the tunnel, but the light at the end of the tunnel is here. But though we can see the way more clearly, we are not out of the tunnel yet. It remains at very high levels in many parts of Canada. Nationally, we are still on an ever worsening trajectory. The months ahead will be difficult. Solution. But we do know that areas of Canada that have adhered to early, strong, and consistent public health measures have been able to slow growth, keep COVID-19 at low levels, or eliminate transmission from an area. The secret to success against this virus is not easy for any of us. It means constant vigilance on the part of everyone and relentless work, together with difficult choices as capacity is stretched across our health workforce. No one should underestimate the difficulties we have faced this past year. I want to acknowledge those, from the many everyday difficulties that have built up over time to the seemingly unbearable challenges, losses, and grief. Every one of us has faced difficulty, whether it has been the loss of a job, strain on family relations or friendships, or the loss of a loved one we could not hold and comfort. To honor all those we have lost and to care for all those who are suffering, let's remember to always speak and act with compassion. We need this more than ever. Let's recommit to caring and kindness, and we can do this. Together, it will be easier. Thank you.
Bonjour à tous.
Speech repeated in French. Hello, everyone. There have been over 668,000 cases of COVID-19 in Canada, including 17,086 deaths and over 82,500 active cases across the country. Nationally, the average case count is now over 8,100 new cases being reported daily over the past week, with a still increasing number of people experiencing severe illness. There are an average of over 4,500 individuals with COVID-19 being treated in Canadian hospitals, almost 850 of whom are in critical care. 145 deaths are being reported each day. It's been a year and a day since scientists first published the genome of the SARS-CoV-2 virus that causes COVID-19. We have made substantial progress since that time, with better diagnostics and treatments. We also have a better understanding of how COVID-19 spreads, as well as a better understanding of effective prevention measures. Most incredibly, we can hear people saying that we can see the light at the end of the tunnel. But though we can see the way out a lot more clearly, we are not out of the tunnel yet. Uncertainty and challenges are still ahead of us. COVID-19 activity remains at very high levels in many parts of Canada. Nationally, we are still on an ever-worsening trajectory. The months ahead will be difficult, possibly harder than anything we've experienced thus far. There is no easy or quick solution, but we do know that areas of Canada that have adhered to early, strong, and consistent public health measures have been able to slow growth and spread, to keep COVID-19 at low levels or eliminate transmission from some areas. The secret to success against this virus is not easy for any of us. We must all remain constantly vigilant for everyone. It is relentless hard work. We will have difficult choices to make as our health workforce's capacity is being stretched thin. No one should underestimate the difficulties we have faced this past year. We want to acknowledge those from the many everyday difficulties that have built up over time to the seemingly unbearable challenges, loss, and grief. Each and every one of us has faced difficulty, whether it has been the loss of a job, strain on family relationships or friendships, or the loss of a loved one we could not hold and comfort. To honor all those we have lost and to care for all those who are suffering, let's remember to always speak and act with compassion. We need compassion now more than ever. Let's recommit to caring and to kindness. We can do this. Together, it will be easier. Thank you.
Merci à tous. Nous allons
Thank you all. We will now take questions.
on the phone for 3 questions, 1 question and 1 follow-up, and then we will come to the room. Opérateur?
Thank you. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from, la première question est de Christy Kirkup de Globe and Bell. Please go ahead, à vous la parole.
Hi, good afternoon. Provide any additional details on the timeline for these 20 million additional doses from Pfizer. The Prime Minister saying they're set to arrive in April or May, and then he said that you would provide additional details. So can you just please provide us with any additional information on the timeline for when Canadians can expect these doses to arrive?
Well, thank you so much for the question. Let me begin by saying back to the vaccine suppliers to push for earlier deliveries in the timeframes that I am giving to you today. So with that acknowledgement, we do anticipate getting a total of 20 million doses in Q2 from Moderna. There are risks in the delivery schedule, which we believe will dissipate as production lines gain maturity. But at the current time, our estimation is 20 million doses in Q2.
And just as a follow-up, if I may, I understand the National Advisory Committee on Immunization is set to recommend on second doses. They're set to release a recommendation on second doses, and I'm just wondering how this will impact negotiations with vaccine makers, and what will the concrete impact of that be?
Well, thanks again for the question. The standpoint that I'm coming from, of course, is from a procurement and negotiation perspective. And in my conversations with the vaccine manufacturers, they have stressed the importance of following the science, or in other words, the scientific reasons that they have recommended the 2-dose regime within a certain time period for the second dose in particular. When we have additional advisories, such as the one you referred to, I will go back to the manufacturers and indicate that this has been forthcoming. But at the current time, what I am hearing from them is the importance of sticking to the recommended schedule, and the greater the provinces and territories do that, the stronger position that I have at the negotiating table in pushing for earlier and earlier deliveries. Thank you.
Merci. Prochaine question.
Thank you. Next question.
Thank you. Merci. The next question is from, la prochaine question est de Hélène Buzetti de Le Devoir.
Hélène Buzetti, Le Devoir. Please go ahead.
My question is also for you. So I understand that you obtained from Pfizer a quicker delivery for 20 million doses. I was wondering, following up on a question that was asked of the Prime Minister, whether or not you had to put additional money on the table to get those earlier deliveries, or I'm talking about money, but I'm talking more generally about anything else. Did you have to put something on the table in order to get those quicker deliveries? Thank you.
Thank you for the question. I just want to be clear, because the first part of your question wasn't quite clear to me. So I just want to mention that those 20 million doses are as a result of exercising options. We already had 20 million doses under our original contract, and we are exercising options to acquire 20 million doses. We are on track to vaccinate all Canadians who wish to be vaccinated by the end of September. We are expecting to receive more than 70 million vaccines between Moderna and Pfizer before the end of the year. And we are also expecting a total of 20 million of those combined doses in Q2. So that clarifies the question, I hope, for you regarding the doses of Pfizer and Moderna. 70 million doses of them prior to the end of September, and 20 million of those doses in Q2. In terms of the payment of those, we did pay fair value for the additional doses that we acquired from both Pfizer and Moderna under option, and we will provide more detail on that when the environment for acquisitions of vaccines becomes more stable. Thank you.
Well, I guess my question was not clear, because you mentioned that some doses will arrive earlier, and I was wondering if you had to put some extra money on the table. But I get from your answer that the answer is no. I just want, and if that's not the case, please clarify. I just wanted to turn my eyes to the schedule, the 2-dose schedule thing. You mentioned the intention of provinces to maybe delay that second doses. Can you be more specific as to the conversation you had with manufacturers in the context of trying to get additional doses? Were they any indication from the manufacturers that they are less willing to provide additional doses because of a province's intention to delay the second dose? Thank you.
Well, thank you for the question. The clarification that I want to make right off the bat is that I have no personal view on what the science is, given that I'm not a scientist and I'm not part of Health Canada, and I'm not making any recommendations myself relating to what the provinces and territories should do. I'm trying to put forward as a factual matter that in our negotiations with the vaccine manufacturers, they, of course, are concerned when the recommended doses based on their clinical trials are not being followed. And they're also concerned when they see that vaccines are not being utilized, vaccines that have been delivered are in freezers, etc. And so these are 2 points that have come up in my discussions with them. One, they would like to see all jurisdictions following the recommendations based on the science. And 2, they would like to see doses used as soon as possible. Thank you.
Merci. Prochaine question. Next.
Thank you. Next question.
Thank you. Merci. The next question is from, la prochaine question est de David Common from CBC News. Please go ahead. À vous la parole.
Yes, hello. This question is for Dr. Tam. Dr. Tam, I have a question related to long haulers. There are other countries, the WHO have urged others to take action, particularly providing additional help for those long haulers. We look at post-COVID clinics that have been set up in some countries. Canada, though, only has 3 of them right now. Do you feel like Canada is lagging behind?
So the provision of care, of course, is within the provincial territorial jurisdiction. I do know that the Canadian Institute for Health Research, for example, is supporting the further understanding of the more prolonged or longer-term impact of COVID-19. And so I think it is important to continue to get more knowledge about this, and for clinicians and others to recognize that there's a lot that we don't know about this virus, and that we need to continue to look after and support those who've had COVID-19.
I wonder if that would include those, Dr. Tam, who didn't get a positive test result because of whatever reason they were told to self-isolate or there wasn't a test available at the time. Those people who didn't have one and are now finding it challenging to find access to the care they feel they need. Is there something that your agency could do in terms of guidance to physicians on recognizing those who may not have had a positive test result but may in fact be suffering from long COVID?
Yes, so the federal government's also supported, studies in terms of serologic assays. Although those are not in widespread clinical use, I think patients should discuss their situation with their physicians and look at what options available to them for further diagnosis, for example. You can also take, of course, an actual history of exposure history and other things. So I think together, combined with that kind of history, as well as looking at what further tests can offer, can lead to the sort of clinical management plan for the patient in discussion with provinces and territories. And I think for certain patients, it may be, sort of ask the clinician to look at what the supported studies are, because by enrolling in certain research studies, you can gain a better understanding, of course, of the clinical course of disease, but also that can help individual patients as well in their further understanding of what illness that they have.
Merci. Thank you. We will now come to questions in the room for 3 questions.
Hi, Mackenzie Gray with CTV News. My first question is for Minister Anand. You just seem to take a swipe at the provinces saying that the drug companies don't like seeing the vaccines sitting in the freezers, but many premiers, Premier Ford, Premier Kenney, have been saying we need the federal government to get us more vaccines sooner so we can get them out to people. They're saying that they're going to be running out soon. So with the 20 million doses today that we have purchased from Pfizer, was a part of the deal that the delivery schedule that your government has already set out between today and March 31st, is that going to change at all? Are we going to see any new vaccines coming in outside of what you've already said in Q1?
Thanks, Mackenzie, for the question. I actually would just like to correct the way you phrased your question in terms of what you were saying I was doing. I prefer to view this effort of mass vaccination that has not shifted at all. Indeed, we are working to make it as precise as possible. And as the Prime Minister mentioned, we have provided specifics relating to weekly deliveries that will be going to the provinces and territories so that they can indeed plan to make sure that they are able to roll out at a local level. And we are working every day to firm up delivery schedules in a week-to-week and month-to-month basis so that the provinces and territories have more information on which to schedule and base their own rollout in their jurisdictions. Thank you.
The September date is thrown around, and the Prime Minister mentioned it, and you mentioned it today. He said that every Canadian who wants to be vaccinated by September will be able to do so by the end of the month. When you say vaccinated, do you mean that they'll be able to get their first shot, or by the end of September, every Canadian will be fully vaccinated with both shots at that point in time?
Well, thanks again for the question, Mackenzie. The sands are shifting in terms of our delivery schedules. As you can see, I come to you with information as soon as I receive it and provide you with the most up-to-date information. The notion at the current time is that we are going to have enough vaccinations to at least perform the initial vaccination. But as you can see, even from our information that we're providing today, we have been working to move up the delivery of vaccines earlier and earlier into 2021. And as more vaccines come online, we know that AstraZeneca and J&J are in regulatory approval, for example. As more and more vaccines come online, we hope to be moving up this schedule even more. But at the current time, we are looking at the end of September to have all Canadians vaccinated. Thank you.
Merci. Thank you. Next question.
Hi, David Thurton, CBC. Minister Anand, do you mind just lowering the boom on your mic? It might improve the audio just a little bit. I know my radio colleagues will appreciate that. Thank you so much, but we'll see if that works. But my question is for Minister LeBlanc. Alberta's premier says that the province is considering procuring its own vaccines because it appears the federal distribution system isn't working. So, Minister LeBlanc, what's going wrong here that a province is trying to now circumvent the federal government in getting its own vaccines?
So obviously, I wouldn't agree with the characterization that something's going wrong here. I exchanged text messages actually earlier today with Premier Kenney, reiterating our desire to collaborate with his government. I took note of his comments yesterday. We obviously understand and share the anxiety of all Canadians that as quickly as possible, we want to have access to as many vaccines as possible. That has been our priority from the very beginning. I think this will be a successful collaborative effort. And if Premier Kenney has any suggestions of what we can do to better support his government in the vaccine logistics, of course, we want to help. But we're very confident that it will go very well. And we look forward to working with the government of Alberta very closely on this.
I'm just wondering from the federal perspective, when you hear a province saying that they intend to procure their own vaccines, what potential problems does it create for the federal government? And maybe Anand particularly, Minister Anand, you can speak to that as well.
Well, thanks so much. And I hope that the boom has been lowered enough on my mic. So let me know if it hasn't, please.
Sounds good to me.
I don't want anyone's ears to be flooded with my voice unnecessarily. Let me just say that we're going to, at a federal level, procure enough vaccines for Canadians as a whole to be vaccinated. And that is our goal as a government. That's a goal that we are accomplishing and we will accomplish. All Canadians will be able to be vaccinated by the end of September 2021. Having said that, we heard throughout this crisis from various premiers that they were looking to procure their own PPE or vaccines now, as the case may be. And we, as a federal government, are in no way inhibiting or blocking them from doing so. But suffice it to say that we have procured enough vaccines to inoculate all Canadians. And indeed, we have the most number of doses per capita of any country in the world. So we look forward to working with the provinces and territories in terms of their efforts to vaccinate each person in their province or territory, and we will continue to engage in that collaborative relationship. Thank you.
Thank you. Next question.
Dr. Tam, this question is for you. We know that long-term care residents are now really starting to get vaccinated. We've vaccinated many of the workers who work there. I'm curious, though, if we've done any modeling or understanding of what impact on the spread of COVID will be achieved by vaccinating that group. We know that they're the most vulnerable, that vaccinating them is really for them, but I'm just curious if we've done any modeling to know if that will help curb the spread in the community to any extent.
So what we do not know as yet are the effectiveness of the vaccines that we have in preventing asymptomatic infection or to reduce transmission. That data is just not there, but I do know that international studies, the vaccine manufacturers, also following that. So we expect to sort of take that data in mind as we look at what the impact of vaccinating persons in long-term care could be. Certainly, I think that the primary goal is, I absolutely think that everyone has to commit to getting vaccines as fast as possible into this population. With that, you know, a month or two later, we should be able to see that there's some impact on severe outcomes. That is one of the earliest signs. At the same time, we need to keep layering on all the protection to prevent the entry of the virus into those populations, and that has to continue infection control. So I think it remains to be seen, but this will be the earliest population, perhaps, of which we can look at that estimate.
And on rapid tests, we heard the Prime Minister today talking about the need to use rapid tests more. But my understanding is just still that most rapid tests are not actually all that good for people without symptoms. And so using them as a way to sort of go in and mass test people who aren't showing symptoms isn't necessarily going to be helpful. Do we have any rapid tests that we can rely on to do that kind of testing yet? And if we don't, do we know that there's any that we're looking at?
Yeah, so the Public Health Agency does have testing guidelines, and that includes the application of what we call point of care testing. And because they are actually different, there's different kind of point of care testing. For certain situations, such as in high-risk populations, when you're doing an outbreak investigation, the most accurate tests are still the molecular tests or the PCR, but those can be points of care and can be actually rapid, kind of rapid tests. And we also have some guidance on that. They do have some limitations in terms of the sensitivity, the ability to detect the virus, because they don't have an amplification step. But there are ways to apply them. If they're freely, you know, they're widely available, they can be fast. What you need to do is reduce that uncertainty by doing serial testing, for example. That can happen. In an outbreak setting, you can combine molecular testing, but also utilize antigen testing to broadly screen a population. Say if you're in an enclosed environment, you know that the virus is there, in which case that increase your probability that if you get an antigen test, for example, that is going to show you the results. And then you can do better infection control in those settings as well. So I do think that because there's now quite millions of these tests that have been provided, we have to work diligently with the provinces to see how they can get them out as fast as we can. Long-term care is a case in point where I think testing as another layer of protection to this environment.
Merci. Nous allons retourner au téléphone.
And now back to the phone lines for 3 more questions.
Now, opérateur.
Thank you. Merci. The next question is from, la prochaine question est de Émilie Bergeron de l'agence QMI.
Émilie Bergeron, Agence QMI. Over to you.
I just need a clarification from Minister Anand. You mentioned earlier that the 20 million doses, additional doses announced today are part of you exercising the options to get more vaccines. So if I remember well, the option, it was 56 million doses that were possible to add. So does it mean that the total option is applied with the 20 million doses, or you could decide to exercise again this option to have more doses eventually?
It's a great question, Emily, and thank you so much. Merci beaucoup. We are exercising 20 million options of the Pfizer vaccine to give us 40 million doses of the Pfizer vaccine at the current time. And we still have the ability to exercise 36 million more options of Pfizer if we like. And for that matter, we can also go back to Moderna and negotiate for additional doses if we wish to do so. And let me just tell you from my standpoint and my department's standpoint is that in those negotiations, we are driving hard towards ensuring early deliveries of the vaccines. So the reason why we chose to exercise those 20 million more Pfizer vaccines is because we were able to have assurance from the manufacturer that the large bulk of those would arrive in Q2 and Q3. And so we want to make sure that the exercise of options is tied to early deliveries, and that's what we've been able to more doses of each of those suppliers. So I hope that answers your question.
Yes, thank you. As a follow-up, peut-être Dr. New.
Follow-up. This question is for Dr. New or for whoever can answer it. When it comes to hospital occupation rates and there not being any capacity in hospitals, what can the federal government do to free up more hospital beds? What can the federal government do for healthcare workforce? Because we might run out of available healthcare workers. What can the federal government do to help? Answer. Dr. New. Minister LeBlanc, would you like to answer? Minister LeBlanc. Go ahead, Dr. New. Dr. New. I will give you the public health perspective on this answer. The Public Health Agency of Canada and Health Canada have always supported provinces and territories. Healthcare capacity is almost at capacity in many regions of the country. We are always ready to deploy more resources to help provinces and territories ramp up their capacities. We also have epidemiological assistance ready, for example, for contact tracing. The federal government also has resources for isolation. Sometimes it's best to isolate away from one's family. So we have many options and many ways in which we can help if we receive requests from provinces and territories, and we work closely with our counterparts. Thank you. Next question.
The next question is from, la prochaine question est de Mélanie Marquis de La Presse.
Mélanie Marquis from La Presse. Please go ahead. Thank you.
Dr. Tam, could you provide us with an update on the AstraZeneca approbation process, please?
Yeah, unfortunately, I'm not the regulator, so that we can be posed to Health Canada. But what I do know is that they are still reviewing the information, and that data has been coming in.
Following up on that, is there some kind of a holdup because of, I know you're not the regulator, but in your opinion, according to the literature, is there a holdup because of the problems AstraZeneca experienced during the trials?
All I know is that Health Canada has requested clinical and other data and manufacturing data from the manufacturer or the company, and they're working those through as fast as they can. So I think that's probably all that I can say.
Merci. Prochaine question.
Thank you. Next question.
Thank you. Merci. The next question is from, la prochaine question est de Fiao Lili de CT News. Please go ahead. À vous la parole.
Good afternoon. This is another question for Minister Anand. I'm looking for some clarification on the Pfizer vaccine option being exercised. I understand Canada previously declined an option for more Moderna vaccines. What were the factors in decision-making and deciding to exercise one option and declining another, knowing that one of these vaccines requires some fairly specialized cold storage?
Thank you so much for the question. Actually, I just want to clarify that we did exercise 20 million Moderna options. So in other words, we contracted for 20 million. We had options on additional Moderna options, and we chose to exercise 20 million of those options. And as I answered previously, the rationale was because we knew that we could, after negotiating with Moderna, receive those additional 20 million Moderna options prior to the end of September, which is our goal to ensure that all Canadians are vaccinated by. And so I believe you're referring to 16 million options that Canada chose not to exercise. And I will say simply that we didn't have the assurance from the supplier with regards to those 16 million that we would receive them by the end of September 21. But I will add that we have the ability to go back to Moderna and negotiate for additional doses should we decide to do so. But given the large number of doses in our portfolio and our ability to secure earlier and earlier doses through the exercise of the now total 40 million options, if you combine Moderna and Pfizer together, we are well placed to ensure that we will meet the September 30th deadline, if not before. Thank you.
Thank you for that clarification. Just as a follow-up, I just wanted to ask another question with respect to what the Alberta Premier expressed his sort of dissatisfaction with this federal purchasing and distribution strategy. Could you just reiterate some of the advantages and disadvantages of Canada buying vaccines all as one rather than all the provinces going to market?
Well, thanks again. What we saw through the first part of the crisis in our purchase of personal protective equipment and what we are seeing now in the purchase of vaccines is that the vaccine companies are very willing to do negotiations and contracts with us because we are buying in bulk for the entire country. And indeed, when you look at the population of Canada, which is about 37 million, that is relative to the rest of the world, not a large population. And so we really need to band together, I believe, to ensure that we are putting the best foot forward as a country in negotiating for the entire country. And that's exactly what the government of Canada has done with fortitude. We have secured the largest per capita doses of any country in the world. We have enabled ourselves to be at the front of the line of Pfizer and Moderna for the initial doses of vaccinations. We have ensured that all jurisdictions in this country are offering inoculations at the current time. And so our very tough negotiating stance back in August and September is continuing to pay off, notwithstanding the fact that we are continuing to negotiate hard with all of these suppliers, Pfizer and Moderna included, and I am engaged personally with them as well. And so we are very willing, of course, to continue to negotiate for all Canadians, and we will continue to do so. That is our role as a federal government, and we look forward to continuing to support the provinces and territories in their rollout of the vaccine campaign.
Thank you. We will take a final question in the room and then a final on the phone. So 2 last questions. McKen.
Dr. New, I've got a sports question, so I'll pose it to you. I think I don't mean to offend you, Dr. Tam, but normally he takes the sports questions. Eugene Melnick, the owner of the Ottawa Senators, he's just tweeted saying that he's submitted a robust safety plan that will allow for 6,000 fans to see Senators games in the Canadian Tire Centre. I don't know if that falls into your federal jurisdiction, but do you think it's appropriate at this point in time that we have indoor spectators at hockey games?
Thank you very much for the question, Mackenzie. And you're right, that's not within the federal mandate. Our federal mandate, as you well know, has been with our international borders. So when it's sort of related to the sports files in the past, I've certainly put forward sort of the federal government's position with respect to crossing the international border for, let's say, sports teams being the Blue Jays in the past and the Raptors. In this case, with the NHL, now that they have sort of a northern division, the NHL certainly took into account the federal stance on the border, and all of the Canadian teams will be playing exclusively in Canada. And so it really was a more sort of a provincial sign-off that was needed in terms of allowing teams to play in Canada. With respect to local situation, I would certainly defer to local public health authorities. The medical officer of health, Dr. Retch, is here in Ottawa in terms of what would be appropriate in terms of public health measures, in terms of group sizes, how many people can gather together for any type of event, be it sporting and otherwise. So that's how I would leave it. Thank you.
Merci. Nous allons donc passer au téléphone pour la toute dernière question. We will now take a final question on the phone. Opérateur.
Thank you. Merci. The next question is from, la prochaine question est de Diana Gonzalez de Radio-Canada. Please go ahead. À vous la parole.
Hi, this is a question for Mrs. Anand. This is Caroline Quash from the National Advisory Committee on Immunization said today that they recommend to give a second dose of vaccine no later than 6 weeks after the first dose. What do you think about that?
Merci beaucoup pour la question et je vais commencer avec...
Thank you for your question. I will start by responding and then I will give the floor to Dr. New and Dr. Tam.
My role is as the procurement minister, and so I will bring this information from the National Committee forward to the manufacturers and discuss that with them and see if their views in terms of their recommendations change, and as a result, whether our ability to secure doses is altered at all. But at the current time, and today especially, I think we should think very positively about what the federal government has been able to do. We are exercising 20 million options of Pfizer. We are ensuring that we have 20 million of Pfizer and Moderna doses in this country combined in Q2. We are ensuring that we will have 70 million vaccines between Moderna and Pfizer in this country prior to the end of September, so that all Canadians who wish to be vaccinated can be vaccinated. And so those accomplishments are as a result of our ability to negotiate with the vaccine companies, our ability to get results from these companies, our ability to move Canada up in the line time and again for acquisition of these vaccines. And of course, we will not stop. We will continue to press these companies for earlier and earlier entry. Thank you.
C'est Dr. New. Je ne sais pas, est-ce que vous voulez une réponse en français?
Dr. New here. Would you like the answer in English or in French? In French, please. Dr. New. All right, I will answer in French. If perhaps Dr. Tam will add a few comments. One thing is for sure. We have 2 approved vaccines in Canada. Pfizer and Moderna have submitted their data. These are 2-dose vaccine regimes. We're on the same page as provinces and territories. We're on the same page about the fact that it is ideal to give 2 doses of vaccine to each person. At the same time, our current amount of vaccines in Canada is limited. Many people who get COVID-19 become very... The advice of the National Advisory Committee on Immunization. We are also looking at what's happening in other jurisdictions and countries around the world. Based on current data, there can be an interval of between 28 and 42 days between the first and second vaccine. Our National Advisory Committee on Immunization, whose president is Dr. Quash, will soon, perhaps even today, publish their recommendations on this matter. These recommendations will highlight what we have already said. In general, in Canada, we are recommending 2 doses. That said, we do need to be flexible in assessing the epidemiological situation in various regions of the country. Based on data, currently available data, it can be up to 42 days. Now, a given province or region might want to wait longer, have a longer interval. It is always best, however, to follow best available scientific data. Dr. Tam, anything to add? No? All right then. Thank you. Follow-up question. Yes, but would a 6-week interval be acceptable? Answer, Dr. New. Well, ideally, if we have many doses, then the ideal timing would be 28 or 35 days, depending on whether it's Pfizer or Moderna. Based on best available scientific data, based on studies that have been done, it seems that it's possible to wait up to 42 days. I can't predict exactly what the National Advisory Committee on Immunization will recommend, but they have studied the data and they will be publishing the recommendations very soon, possibly this afternoon. That's great. Thank you, everyone.
Press conference, this puts an end to today's presser.